नहीं नहीं ठीक है, थैंक यू। लॉगिन भी आपका लगा हुआ है? नहीं नहीं वो मेरे ख्याल लाइब्रेरी। अच्छा ठीक है। मेरी नेक्स्ट भी लॉग आउट करना पड़ेगा ना। चलें ठीक है, थैंक यू। फिर मैं लगा दूंगा ना, आपको अपना लगा दूंगा। आप मेरा कर दीजिएगा और अपना लगा दीजिएगा, मैं अपना नहीं लगा। ठीक। जी अस्सलाम वालेकुम क्लास। अच्छा आप सबको मेरी आवाज़ साफ सुनाई दे रही है? इज़ इट क्लियर?
ओके, गुड। वेरी गुड। और मुझे ये बताइएगा कि मुझे जो कुछ ओवर में मिला है वो मैडम अनीस ने जो मुझे जो कुछ बताया है तो उसके अकॉर्डिंग जो आपको सब कुछ ना पढ़ा दिया गया है। इज़ इट क्लियर? एग्री करते हैं आप? एग्री करते हैं? आप थोड़ा सा स्लो हो गए हैं सारे, क्या बात है? ओके, ग्रेट। मैं थोड़ा सा इस पे आपका चाह रहा हूँ कि देख लूँ कि क्या इसमें और एडिशन हो सकती हैं चीज़ें। हेल्थ असेसमेंट हमने बढ़ा दिया है, फिजियोलॉजी करवा रहे हैं और यूटिलाइजेशन। हबीबा हैं यहाँ पे? हबीबा, आप अगर मुझे सुन रही हैं तो मैंने आपको कहा था कि मुझे सारे लेक्चर्स हैं वो ईमेल करने हैं। हबीबा सुन रही है मुझे? आप तो उस दिन एडमिट करके गई हैं कि सर मेरे पास हैं। ये तो देखिए, आप उस वक्त मुझे ये कह रही हैं कि मेरे पास हैं, अब आप कह रही हैं कि इफ़रा के पास हैं। इफ़रा, आप काइंडली मुझे वो लेक्चर सारे ईमेल कर सकते हो? थैंक यू। अच्छा, मैं ये देख रहा हूँ सारे आपके कंटेंट्स मेरे सामने ओपन हुए हैं कि अच्छा, आपको जो कार्डियक पोर्शन था वो मैडम राफेल ने करवाया? ओके, उन्होंने भी शेयर की हैं आपसे सारी प्रेजेंटेशन? ओके, कंटेंट्स तो आपके ठीक ठाक है, मैं ये देख रहा हूँ। ओके, अच्छा, क्लास में ये बता दें कि अब पढ़ाने वाला तो मेरे ख्याल में कुछ कंटेंट बाकी नहीं है। तो मैडम ने आपके टेस्ट कितने लिए हैं? कौन कौन से टॉपिक के टेस्ट हुए हैं आपके? सादिया, लुबाना, इफ़रा, अस्मा, हबीबा। हबीबा नहीं है अभी मेरे ख्याल में, हबीबा चली गई है। वो उससे वाइड करना पड़ेगा थोड़ा। यस, और टॉपिक के हुए हैं टेस्ट, इतना कौन कौन से काइंडली प्लीज़ उनके मुझे बता सकती हैं जो टॉपिक थे उनके टेस्ट हुए आपके? रेस्पिरेटरी, मैकेनिकल वेंटिलेटर एंड इलेक्ट्रोलाइट, 3 हो गए। इसके अलावा एक और और मुझे ये बताएं कि मैडम राफेल की क्लास जो है वो किन डेज में होती है? ABGs भी हो गया आपके? क्यों?
Hey everyone, it's Sarah, registered nurse, RN.com. We're going to be going over partially versus fully compensated arterial blood gas practice problems. Now, if you watch this YouTube video, don't forget to access the free quiz that will give you more ABD practice problems. So let's get started. Now, in our previous video on how to solve ABG practice problems, we used the tic-tac-toe.
Practice, make sure the arterial sample you've got is actually arterial. Base information, PaO2, and also the electrolytes and perhaps some other results that you may not think you've requested, they actually have, and therefore you need to have a look at them too. Bulimia and anything below 7.25 is acidemia. And remember, the emia suffix tells you the state of the blood, and the process suffix tells you the process that is occurring. So acidosis or alkalosis tells you the process, acidemia, alkalemia tells you the current state. And that is CO2. And you do CO2 next, if you don't, you may get confused. So there's pH and then CO2. Step 2, look at the PaCO2. The more CO2 you have, the more hydrogen ions are being produced as it is dissolved, and so the more acidic the blood becomes. You just need to know that CO2 is acidified. So a high CO2 makes the blood acidic, and a low CO2 makes the blood more alkaline. Now you need to combine step 2 with step 1. If both agree, then the problem is respiratory. Here the CO2 is acidifying, while the pH is acidic, so they move in the same direction, and so the
मैम राफेल जी इसमें सभी जगह ओके चलिए ये ज़रा ना एपीजीज पे थोड़ा सा डिस्कशन कर लेते हैं, ठीक है। आप सबको एपीजीज इंटरप्रिटेशन तो आती है ना? ये ज़रा सुनिए और ज़रा देखिए क्या है।
Hi everyone, and welcome to this video tutorial on how to interpret arterial blood gases in 3 easy steps.
And welcome to the video tutorial
proficient
on
in
how
this
to
by the end
interpret
of this
arterial blood
tutorial.
gases in
We'll start off going through these 3 easy steps, and then at the end we're going to go through quite a few examples so we can work through together, and then you'll be flying solo by the end of that. So in practice, make sure the arterial sample you've got is actually arterial and not venous. You can check this perhaps looking at the oxygen saturations or the PaO2 to make sure they correlate with the clinical picture. And of course, make sure it belongs to the patient you think it belongs to. Next, make sure that you have a look at all the results given to you by the gas analyzer. So that's the acid-base information, the PaO2, and also the electrolytes and perhaps some other results that you may not think you've requested, but you actually have, and therefore you need to have a look at them too. Once you've understood those fundamental basics, let's move on to the 3 easy steps, starting with
अच्छा इसमें बताया जा रहा है कि आपने बेसिकली जो है ना 3 चीज़ों को जो है ना बेसिक जो है ना फोकस करना है एबीजीज में, ठीक है। बताना व्हाट आर द 3 थिंग्स, 3 मेन कंपोनेंट्स जो may consider most important। कौन कौन सी हैं जी? एक जो है वो pH, सेकेंड वन क्या है बाइकार, एंड थर्ड वन क्या है? ऑक्सीजन है या कार्बन डाइऑक्साइड है? जल्दी से बताएं। आवाज़ आ रही है आपको? ओके कार्बन डाइऑक्साइड। ओके चलें जी देखें नेक्स्ट।
with step 1. Step 1. Look at the pH. The normal range for pH in the blood is 7.35 to 7.45. So anything above 7.45 is alkalemia.
हाँ जी नॉर्मल रेंजेस क्या हैं जी पीएच की? कौन बताएगा मुझे? नॉर्मल रेंज ऑफ pH in the blood। क्या है जी नॉर्मल रेंज तो सामने लिखा हुआ है 7.35 to 7.45। वेरी गुड। अच्छा मैं कुछ चीज़ें थोड़ी सी आपसे शेयर ये कर दूँ फिर सबसे पहले आप वाई देयर इज़ नीड फॉर एबीजीज, वाई देयर इज़ नीड फॉर एबीजीज। हाँ जी मैं ये क्यों आपने एबीजीज सैम्पलिंग क्यों ज़रूरी है और कब की जाती है? व्हेन एंड व्हाई, व्हेन एंड व्हाई। क्वेश्चन आपसे ये है पहला, मुझे इतना बताएंगी कि क्यों की जाती है एबीजी सैम्पलिंग, एंड बिफोर इट व्हाट आर द कंपल्सरी steps. Compulsory test before. What are the compulsory tests to draw the sample? To know the present condition of the rate to the blood and patient, to know the lungs condition mainly, only lungs. जो भी पेशेंट आपके पास कोई भी प्रॉब्लम के साथ आता है, लंग्स प्रॉब्लम, तो उसके एपीजीज मैंडेटरी होते हैं. इतना कहाँ आएंगे? लंग्स कंडीशन मेनली मैं शायद आपकी इस बात से एग्री ना करूं कि लंग्स कंडीशन आप एपीजीज में नो, strongly disagree with your statement. Lungs condition, no. It also mentioned blood gases. तो बेसिकली ये भी चीज़ में तो यही आप देख रहे होते हो. बेसिकली आप जो ब्लड की पीएच देख रहे हो और उसमें कार्बन डाइऑक्साइड एंड उसमें जो आपका बाइकार्ब लेवल है, ठीक है, आप बेसिकली वो उसको देख रहे होते हो. ठीक है. हाँ, लंग्स का जो है ना वो कंपनसेटरी मैकेनिज़्म, फिर आप कह सकते हो कि कंपनसेशन करने में जो है ना लंग्स और किडनीज जो हैं वो रोल प्ले कर रही होती हैं. ठीक है. अगर कार्बन डाइऑक्साइड ज़्यादा हो जाए तो फिर लंग्स और किडनीज उसमें जो है ना वो एक्टिवेट हो जाती हैं ताकि उसमें एक्सेस जो बाइकार्ब लेवल है उसको जो इंक्रीज हो रहा है उसको कंपनसेट किया जा सके. ठीक है. ओके. वेयर इज इफ्रा? ओके. आगे देखेंगे क्या कहती है.
And anything below 7.35 is
the
acidemia.
tests.
And remember, the emia suffix tells you the state of the blood, and the osis or suffix tells you
10.35 to
the process that is
7.45
occurring.
and,
So acidosis or alkalosis tells you the process, acidemia, alkalemia tells you the current state. So I've color coded this so that you can quickly decide if something is alkalinizing or acidifying during this tutorial, and that should hopefully make it a bit easier for you. And by the end of this, you'll be flying solo without these color codes. Now I've had a look at the pH, the next thing to have a look at is CO2, and you do CO2 next. If you don't, you may get...
These terms can be some difficult for you people. For example, the pH is greater than 7.45. This condition is called the alkalosis, and because this is related to the blood, and we can call it the alkalemia. Okay, alkalemia, and this pH is greater than less than 7.35. We say that condition is acidosis, and we can call it the acidemia. यहाँ तक एग्री हैं आप मेरे साथ? Did you agree? एग्री हैं स्टूडेंट?
get confused. So it goes pH and then CO2. Step 2. Look at the PaCO2.
Okay. Next step is to look for the CO2. What is the normal range of CO2? What is the normal range of CO2? CO2? आसमा खान, ये आप ऑक्सीजन का बता रही हैं 72 to 100. ठीक है. Sahara Rouge is quite yes 35 to 45 is the CO2 normal ranges. IFRA 4.7. IFRA आप कौन सी वैल्यू बताना चाह रही हैं? ये तो आप मुझे लगता है पोटाशियम की लेवल बता रही हैं. पोटाशियम का भी इतना नहीं होता, 3.5 to 5 होता है. हर किसी की डिफरेंट है वैल्यू. ये मैडम बाइकार्बोनेट की है लुबाना 22 से 26. ठीक है, ये हालात हैं आपके.
The more CO2 you have, the more hydrogen ions are being produced as it is dissolved, and so the more acidic the blood becomes. You just need to know this. CO2 is acidifying. So a high CO2 makes the blood acidic, and a low CO2 makes the blood more alkaline. Now you need to combine step 2 with step 1. If they both agree, then the problem is respiratory. So here the CO2 is acidifying, while the pH is acidic, so they move in the same direction, and so the problem is respiratory. And in this case, it was.
मुझे जो बता रही हैं इफ्रा you was asking it 4.7 to 6. आपने पता नहीं ये कहाँ से पढ़ी है, पर हमारे पास जो रेशियो हैं वो हम इसको मिलीमीटर ऑफ मरकरी में काउंट कर रहे हैं ना. ये किलो पास्कल में आपने या हो सकता है मुझे बताएंगे, बट इट इज़ करेक्ट. लेकिन मोस्टली जो है वो पूछी जाती है मिलीमीटर ऑफ मरकरी में. अच्छा, लुक एट द. अच्छा, स्टेप 1 फर्स्ट क्या होगा?
Respiratory acidosis. Likewise, if the CO2 is alkalinizing while the pH is alkaline, then it is also a respiratory problem and a respiratory alkalosis. If the CO2 doesn't agree with the pH, then you have probably got a metabolic problem. In this case of an acid pH, you have probably got a metabolic acidosis, but you still need to finish the process to confirm this. So here you have an alkalosis where step 2 is conflicting. So the problem is probably metabolic, and this time a metabolic alkalosis, but you still need to finish the process and move to step 3. Now I've had a look at the CO2, it's time to look at the bicarbonate.
अच्छा, इसमें ये क्या बताना चाह रहा है आपको? इसमें ये बताना चाह रहा है कि रेस्पिरेटरी एसिडोसिस में जो पीएच और कार्बन डाइऑक्साइड हैं, एसिडोसिस में वो क्या होगा कि उनकी डायरेक्शन जो है वो अपोजिट होगी पीएच की और कार्बन डाइऑक्साइड की. ठीक है, तो क्या होगी? काजेस नहीं, अगर काजेस जो रेस्पिरेटरी होगा ना, ये बात हमेशा अपना अपने उसमें नोट करनी कि काजेस रेस्पिरेटरी जब होगा, रेस्पिरेटरी काज में हमेशा पीएच की और कार्बन डाइऑक्साइड की जो डायरेक्शन होगी वो अपोजिट होगी. ठीक है, ऐसे ही आपको बताया था मैडम ने. कॉजेस क्या हों? कॉज इन रेस्पिरेटरी the direction of pH and carbon dioxide will be in different direction. वेरिएशन इन CO2 एंड pH एग्री करते हैं आप इससे? ठीक है। अच्छा ठीक है जी, ठीक है, मैं आ रहा हूँ उस तरफ। अच्छा जी, नेक्स्ट देखिए।
Or basic cess. You can use either, they will essentially tell you the same thing. Step 3. Look at the bicarbonate or basic cess. So here I've displayed the normal range for bicarbonate and basic cess. We'll just concentrate on the bicarbonate. In practice, it doesn't really matter which you use as long as you stick to the principles. So the bicarbonate is your major buffering mechanism of your body's acid-base homeostasis. So if it is high, it is alkalinizing, and if it is low, it is acidifying. Now what you need to do in step 3 is combine it with the result you have.
Okay, if for example the pH is a mean, your bicarbonate level is increasing from 26, then its condition is the alkalizing, ठीक है। और अगर वो कम आ रही है, 22 से कम हो रही है, तो this condition is acidifying.
Had from step 2. In this example, we would have already decided the problem is.
Okay, look at the bicarbonate is step 1, first pH, then carbon dioxide, and then bicarbonate.
Is a respiratory acidosis. But as the bicarbonate now moves in the opposite direction, here it is blue and alkalinizing.
अच्छा, अब मैं आपको ये बात बता रहा हूँ, अगर मैंने तो बात की अगर काज है रेस्पिरेटरी, तो उसमें पीएच और कार्बन डाइऑक्साइड जो है वो अपोजिट डायरेक्शन में होंगे, ठीक है। आइदर जो है एसिडोसिस है, आइदर जो है वो अल्कलोसिस है। बट इन केस ऑफ अल्कलोसिस, अगर काज जो है ना वो मेटाबॉलिक है, उसमें पीएच और कार्बन डाइऑक्साइड की जो डायरेक्शन है वो क्या होगी, वो सेम होगी।
Then we can say it is compensating. So it's moving in the opposite direction here, so it is compensating. So this is a partially compensated respiratory acidosis. Now only partial, because if it were full, then the pH would of course be normal. Now in this example from the results of step 2, we would have diagnosed a likely metabolic acidosis. In step 3 here, we can now confirm it as a metabolic.
मैंने आपसे कहा कि मेटाबॉलिक कंडीशन में आपने क्या करना है, जो पीएच और कार्बन डाइऑक्साइड है वो क्या होगी, इन सेम डायरेक्शन होगी, और उसको कंपनसेट करने के लिए जो बाइकार्ब होगा,
acidosis, as the bicarb moves in the same direction as the pH. So now have a glance at the CO2 again, and since it's moving in the opposite direction to the pH, we can say there is partial compensation here as well. So this is a metabolic acidosis that is partially compensated.
ओके, कोई नहीं, आप उसको बेस बना के करें। metabolic in same and R is in opposite. Okay, for your own understanding, R is a reverse and M is a good.
Another example here, from the results of step 2, we would have gathered that since the pH and CO2 both move in the same direction, in this case in the alkaline direction, we would have diagnosed a respiratory alkalosis. In step 3, we can see that the bicarbonate is moving in the opposite direction, so step 3 adds to our diagnosis by telling us it is partially compensated. So here we've got a respiratory alkalosis that is partially compensated. In this example, the CO2 is acidifying while the pH is alkaline, so the problem is an alkalosis, and it's likely to be metabolic since step 1 and step 2 aren't moving in the same direction as each other. And in step 3, we can confirm this as the bicarbonate is moving in an alkalinizing direction, which confirms a metabolic alkalosis. And since the CO2 is moving in the opposite direction to the pH, we can say it is compensating. So this is a partially compensated metabolic alkalosis. So what if the pH is normal? And what does it look like when there's no compensation at all? So what happens if the pH is normal? Well, this could either be because your patient is fine and the CO2 and bicarbonate is normal and there's no disturbance whatsoever. Or maybe there is full compensation. So it is still important to go through all the steps 1, 2 and 3. Here we can see a normal pH. But in step 2 and 3 we find an abnormal CO2 and bicarbonate. So we need to put this in the context of the clinical picture, because this could either represent a fully compensated metabolic alkalosis or a fully compensated respiratory acidosis. The respiratory acidosis in general is probably more likely, as there are many patients with COPD who chronically retain CO2, and if the body didn't compensate in some way, then the patient would be permanently acidemic, so the bicarbonate goes up and it stays up. Again, we have a normal pH here, but the CO2 and bicarbonate are abnormal in the opposite direction to the previous example. So think, which is more likely for your patient? A fully compensated metabolic acidosis or a fully compensated respiratory alkalosis? Now that will depend on the clinical scenario. Okay, that's 3 easy steps, but now let's go through some examples so you can see just how simple it really is. We'll start by colour coding things to make things a little bit easier, and then we'll get rid of the stabilisers and see how you go. So here's your first example. Step 1, look at the pH. Well, the pH here is 7.30 at acidemia. Step 2, look at the CO2. CO2 here is high, and that's acidifying. So since step 1 and step 2 both move in the same direction, this means it is a respiratory problem and a respiratory acidosis. Step 3 is look at the bicarbonate, and since it is high, it is moving in the opposite direction of the pH, meaning there is some compensation. And so this is a partially compensated respiratory acidosis. The pH here in step 1 is 7.50, an alkalemia. The CO2 is low, so that's less acid, alkalinizing, moving in the same direction as the pH in step 1, therefore this is a respiratory problem, a respiratory alkalosis. In step 3, the bicarbonate is moving in the opposite direction, since it is low, which means there is partial compensation of this respiratory alkalosis. In the third example, the pH is low, meaning an acidemia. Step 2, the CO2 is low as well, and that means less acid, more alkaline. They're both moving in the opposite direction, and so this is probably metabolic acidosis. In step 3, have a look at the bicarbonate. Yes, it is low, which means that's acidifying, confirming our suspicion that this is indeed a metabolic acidosis. And since the CO2 is moving in the alkaline direction, this is partial compensation of a metabolic acidosis. So here the pH is normal, but we still need to go through step 2 and 3, because step 2 is not normal, as the CO2 is high, acidifying, and in step 3 the bicarbonate is also high, which is alkalinizing. So this could either represent a fully compensated metabolic alkalosis, since the metabolic component is moving in an alkaline direction, or this is a fully compensated respiratory acidosis, since the respiratory component is moving in the acid direction. Now it will depend on the clinical scenario. In another example here, the pH is low, so an acidemia. In step 2, the CO2 is 9, which is acidifying, and since both are moving in the same direction, the problem is respiratory, and the pH is low, so this is a respiratory acidosis. And in step 3, the bicarbonate is normal, so there's no compensation. So this is a non-compensated or uncompensated respiratory acidosis. Okay, 2 more examples before we move the colour codes. The pH here is 7.5, and that is high, so alkalemia is present. The CO2 is low, so everything's moving in the same direction now, so this is a respiratory problem, so a respiratory alkalosis. Step 3, that shows us that the bicarbonate is normal, and that means there is no compensation. So this is an uncompensated or non-compensated respiratory alkalosis. And the last example before we take away the colour codes, the pH is 7.1. That's very acidic, your patient's really not very well at all. Step 2, the CO2 is normal. Since they're both not moving in the same direction, the problem is probably metabolic. In step 3, the bicarbonate is 9, that's very low, and explains the acidosis, or explains the acidemia. So this is an uncompensated, since the CO2 is normal, an uncompensated metabolic acidosis. Okay, so we've got rid of the colour codes, so you need to work out if things should be red or blue, acid or alkaline. So the pH here is 7.51, you can have a look at the normal ranges there. This is high, so that's alkaline, blue. Step 2, CO2, that is low. That's also alkalizing, since there's less CO2 around, and we know CO2 is acidifying. So both are alkalizing, moving in the same direction. The problem is a respiratory problem. This is a respiratory alkalosis. Step 3, have a look at the bicarbonate, which is normal. So there's no compensation. So this is an uncompensated respiratory alkalosis. In this example, the pH is 7.11, which is below the normal range. So this is an acidemia. In step 2, the CO2 is within the normal range. So it's not moving in accordance with the pH in step 1, and so the problem is probably metabolic. In step 3, we see the bicarbonate is low, which is acidifying. So this is moving in accordance with the pH, and so we're right. This is a metabolic acidosis, and the CO2 is normal, so there's no compensation. So for this example, you can pause the video, have a couple minutes break before coming back to it. Okay, let's move on. The pH is 7.30, it's acidic. Step 2, the CO2, 3.0, that's alkalizing. So they're not moving in the same direction, indeed they're moving in opposite directions, so the problem is probably metabolic. Let's have a look in step 3 to confirm. Yeah, the bicarbonate is 15, that's acidifying. That moves in the same direction as the pH, confirming our suspicion this is a metabolic acidosis. And since the CO2 is low and alkalizing, we can say there is partial compensation. So this is a partially compensated metabolic acidosis. 3 more to go, you're doing well. pH is 7.27, acidemia. Step 2, the CO2 is low, which is alkalizing. They both move in different directions, so this is probably a metabolic acidosis. Let's have a look in step 3. The bicarbonate is low, it's very low, so this is a metabolic acidosis. Now the CO2 is low, alkalizing in the opposite direction of the pH, so there is some partial compensation here. 2 more to go, we're nearly there. The pH in step 1, 7.50, that's an alkalemia. Step 2, the CO2 is 7.5, that's acidifying because it's high. They both move in opposite directions. It's probably a metabolic alkalosis. Let's have a look in bicarbonate, which is high, that's alkalizing, confirming our suspicion that this is a metabolic alkalosis. CO2 is high, that's moving in the opposite direction to the alkalosis, so there is partial compensation. And our last example, have a look at it closely. Okay, the pH is acidic. In step 2, the CO2 is also acidic. And in step 3, the bicarbonate, well, that's also acidic. We haven't covered this possibility. Well, it's not that common, but it's very simple. If everything moves in the same direction, then it's a mixed problem. So here it's an acidemia. Everything's moving in the same direction, so it's a mixed respiratory and metabolic acidosis. If everything was moving in the alkaline direction, it would be a mixed alkalosis, although I think that's somewhat uncommon. So that's 3 easy steps on how to interpret an arterial blood gas. I hope you're feeling much more confident now. I'll see you soon.
अच्छा ओके अभी नमाज के बाद फिर आ जाएं बेशक इसको साइन आउट ना करें तो मैं एक और वीडियो देख रहा हूँ जिससे ना मैंने लर्निंग की थी विच इज़ इंटरप्रिटेशन की इसको आज कंप्लीट कर लेते हैं ठीक है तो आपको कोई फ़ायदा हो यहाँ पे बैठने का कि एक चीज़ इंटरप्रिटेशन से आपकी थोड़ी सी कंसेप्ट जो है वो क्लियर हो ठीक है मैं वीडियो सर्च कर रहा हूँ, मुझे मिल नहीं रही। No. Metabolic. respiratory process. Acidosis. Metabolic साइन आउट कर दूँ
अस्सलाम वालेकुम भैया, आप मुझसे ना ऑफिस ना आने दें, अभी शोर पड़ेगा। ठीक है, मैं आपको 15 तारीख तक पेमेंट कर देता हूँ, वो दे ना दे मैं कर देता हूँ, आप टेंशन न लें, मैं आपको कर देता हूँ।
Hello, how are you, class? Abda is present only in after 4 p.m. because she get a time right now. She is the most busy student in our post basic diploma. Yes, no voice. There is no voice. I was silent. अच्छा मैं अभी ना एक वीडियो बड़ी अच्छी देख रहा था बिकॉज आई एम हेयर फॉर यू. अच्छा ये फ़ायदा हो रहा है आपको कोई थोड़ी सी एपीजीज की या थोड़ी सी आपको अगर अंडरस्टैंडिंग डेवलप हो जाती है इट्स मीन दैट इट कुड बी अ वेरी प्लेजेंट बड़ा अच्छा होगा कि अगर इंटरप्रिटेशन मैंने एक स्टूडेंट की वीडियो मेरी पास में एक वीडियो थी बहुत अच्छी पता नहीं कहाँ गुम हो गई है एक्चुअली इसके बाद ना मैं आपको सिनेरियोज देता हूँ ठीक है हमने वो ना आज फिल करना है
What is going on, guys? Don checking in. Welcome to Mint, where we bring nursing to you. So, today we are going to talk about the easiest way to interpret your arterial blood gases. So, if you're ready, we're ready. Let's go.
Hello, this is the 3-step ABG interpretation. But before we dive into the actual steps, let us talk about basic concepts that you need to know for this lecture. Starting with, what is ABG? ABG stands for arterial blood gases. Arterial blood gases are simply the measurements of the acidity or alkalinity of the arterial circulation. It also measures gases such as oxygen and carbon dioxide. Now we are going to talk about 4 important components that are in your ABG, and those are your pH, your CO2 or carbon dioxide, your HCO3 or bicarbonate, your PaO2 or oxygen. And we're going to talk about them one by one, starting with your pH. The pH is pretty much the measurement of how acidic or alkalotic the blood is. your normal value for your pH is 7.35 to 7.45. And we're going to talk about the significance of these numbers later on. Next component would be your PaCO2. Your PaCO2 is pretty much the measurement of carbon dioxide, and our normal value for this is 35 to 45. Now, it is easy to remember 35 to 45 because if you look at our pH, your pH is 7.35 to 7.45. So just remember 35 to 45 for carbon dioxide. Another concept that I need you guys to remember about PaCO2 or carbon dioxide is that it is being controlled by your lungs. Of course, we breathe out carbon dioxide. Another thing that I want you to relate with carbon dioxide would be acid. Now, I'm not saying that carbon dioxide is an acid. What we're trying to get here is that the amount of carbon dioxide is directly proportional to the number of hydrogen ions being produced, which is related to acid. We're not going to discuss biochemistry here. But all I'm saying is that the more carbon dioxide you have in your blood, the more acidic your blood is. If you look at your normal value here, 35 to 45, if your number is above 45, which indicates that there is more carbon dioxide in your blood, then your blood tends to be on the acidic side. On the other hand, if your value is less than 35, your blood tends to be on the basic side. Next up is your HCO3. Your HCO3 is your bicarbonate. Your normal value for your bicarbonate is 22 to 26. The bicarbonate is being controlled by your kidneys. And just to maintain the pH within the normal range, your lungs and your kidneys tend to work hand in hand to maintain a pH of 7.35 to 7.45. And we will talk about that later on today when we talk about compensation. Earlier, I mentioned that when you see carbon dioxide, relate that with acid. If you see bicarbonate, think about base. The more bicarbonate you have in your blood, the more basic your blood is. If your bicarbonate is more than 26, your blood tends to be on the basic side. On the other hand, if it's less than 22, that means you don't have enough bicarbonate in your blood tends to be on the acidic side. Lastly is your PaO2 or oxygen. This is also being regulated by our lungs, and our normal value for this is 80 to 100. Now, although this is important for us to check when reading our patient's ABG, we don't really need the number when it comes to interpreting whether your patient is having respiratory or metabolic, acidosis or alkalosis. This simply will tell us whether your patient is having hypoxemia or not. But am I saying disregard PaO2 all completely? Of course not. Just for the sake of the lecture, when you need to interpret your ABG, whether it's metabolic or respiratory, acidosis or alkalosis, you just need to look at your pH, your PaCO2, and your HCO3. Does your patient have hypoxemia? Look at the PaO2. Again, your pH refers to the acidity or alkalinity of your blood, and the normal value is 7.35 to 7.45. Your PaCO2 is your carbon dioxide, which the normal value is 35 to 45, and when you see carbon dioxide, think about acid. HCO3, your bicarbonate, your normal value is 22 to 26, and when you think about bicarbonate, think about base. And lastly, your PaO2, your oxygen, it is 80 to 100. Unfortunately, there is no other way around this but just to memorize these numbers. But if you do memorize these numbers, trust me on this, interpreting ABGs will be a breeze for you guys. Now, let us talk about the actual 3-step ABG interpretation. And these are: identify if it is acidosis or alkalosis by looking at your pH. Identify if it is respiratory or metabolic by looking at your carbon dioxide and bicarbonate. And number 3 would be identify if it is compensated or uncompensated. First step is identifying whether it is acidosis or alkalosis. Again, our normal value for our pH is 7.35 to 7.45. If your pH is less than 7.35, you have acidosis. If it is greater than 7.45, you have alkalosis. Let's see some examples. For a pH of 7.25, it's less than 7.35, so you have acidosis. Another example. pH of 7.55 is greater than 7.45. So what do you have? You have alkalosis. Step number 2 would be identifying if it is respiratory or metabolic. And we're going to do this by simply looking at your bicarbonate and carbon dioxide and compare that to your pH. Through this, we will know whether you have respiratory or metabolic condition. And the method that we are going to be using will be the concept method. Now, the most common method being taught in nursing school is what we call the Rowe method, where they ask you to use arrows in interpreting your ABGs. However, we will not be using this here because the Rowe method doesn't really work well for compensated ABG. So for now, we are just sticking with the concept method. So what is the concept method? We talked about this earlier already, and that is carbon dioxide is being regulated by your lungs, while the bicarbonate is being regulated by your kidneys. If your carbon dioxide level is abnormal, while this bicarbonate is normal, you have a respiratory condition. On the other hand, if your carbon dioxide is normal while this is abnormal, you have a metabolic condition. And just to throw it out there, remember that carbon dioxide is to acid while bicarbonate is to base. It is best if we use examples for this method. 7.25, PaCO2 of 50, and bicarbonate of 24. Looking at the pH, we can tell that this is acidosis. Our normal is 7.35 to 7.45. It's less than 35, so it is acidosis. Look at the PaCO2. It's elevated. Our normal value is 35 to 45. We have 50. Just by simply looking at that, this is abnormal, and if you look at the bicarbonate, it is normal. Our normal value is 22 to 26. So this is normal, this is abnormal. What do we have? We have a respiratory condition. Therefore, we have respiratory acidosis. And just by simply looking at the PaCO2, 50, that means you went beyond 45. If you have more CO2, your blood is more acidic. So respiratory acidosis makes sense here. And of course, your bicarbonate is normal. Another example, pH of 7.56, PaCO2 of 28, and bicarbonate of 22. The pH, what does this tell us? Is it acidosis or alkalosis? It's alkalosis. It's more than 45. Looking at the PaCO2, our normal is 35 to 45. It's less than 35 to 45. Look at our bicarbonate. Is this normal? 22 to 26? It's normal. So since your PaCO2 is abnormal, we have a respiratory condition. Therefore, it's respiratory alkalosis. And if you look at the PaCO2, we don't have enough acid in our blood. That means it's making our blood more basic. So respiratory alkalosis will make sense. And of course, our bicarbonate is normal. What about this? 7.25, PaCO2 of 37, and bicarbonate of 21. Looking at our pH, is this acidosis or alkalosis? It is acidosis. Looking at our PaCO2, our normal is 35 to 45. So this is normal. Looking at our bicarbonate, our normal is 22 to 26. Since our abnormal is the bicarbonate and the CO2 is normal, do you have a metabolic or a respiratory? We have a metabolic condition. And since this is acidosis, we have metabolic acidosis. Think about this for a second. Our normal is 22 to 26. We don't have enough base in our blood. That means our blood is more on the acidic side. So metabolic acidosis does make sense. Another example, 7.56. We have 44 carbon dioxide and bicarbonate of 35. Looking at the pH, we have alkalosis. Our PaCO2, it's normal. Our normal is 35 to 45. And our bicarbonate is 35. Since our abnormal is bicarbonate and the CO2 is normal, we have a metabolic condition. And we relate that with our pH. We have a metabolic alkalosis. And this makes sense because the more bicarbonate you have, the more basic your blood is. Now, you guys might be wondering, what if your PaCO2 is abnormal and your bicarbonate is abnormal? Or what if your pH is normal and both of them are abnormal? You have to remember that the examples that we just used just now, these are examples of uncompensated ABGs. If your pH becomes normal and both of them are abnormal, we have compensation going on. We're going to talk about that in step number 3, which is identifying whether it is compensated or uncompensated. My twin brother Ben will be explaining more about this. So Ben, take it away.
Thank you, Don. So we have learned steps 1 and step 2 of reading ABGs.
Step number 3 is identifying whether there is a full compensation or partial compensation. So let's get right to it. After identifying whether it's acidosis or alkalosis and whether it's respiratory or metabolic, we immediately go to the compensatory component of the problem. When we have a respiratory problem, always remember that our metabolic will compensate. That is our bicarbonate. Whether it's acidosis or alkalosis, the body will try to compensate by either increasing or decreasing the amount of bicarbonate in our system. When we have respiratory acidosis, the body will try to compensate by increasing the amount of bicarbonate in our system. Remember, bicarbonate is a base, so one of its function is to neutralize the acid that's causing the problem. When we have respiratory alkalosis, it's gonna do the opposite. The body will compensate by decreasing the amount of bicarbonate. For us to conclude that there's compensation, the increase or decrease has to go outside the normal range. So it has to be higher than 26 or it has to be less than 22. If bicarb is still within normal limits, then there is no compensation going on. Okay, moving forward. When we have a metabolic problem, always remember that our respiratory system will compensate. So that is our carbon dioxide. So again, depending whether it's acidosis or alkalosis, the body will try to compensate by either increasing or decreasing the amount of CO2 in our system. When we have metabolic acidosis, the body will compensate by decreasing the amount of CO2. Remember, CO2 is associated with acid, so when the body detects that there's acidosis, obviously it's going to try to decrease the amount of CO2 in our system. When we have metabolic alkalosis, it's going to do the opposite. The body will try to compensate by increasing the amount of CO2 in our system. And just like in respiratory, for us to conclude that there is compensation going on, the decrease or increase has to be outside the normal range. So it has to be less than 35 or greater than 45. Otherwise, there's no compensation going on. So let's use some examples. pH is 7.30, CO2 is 50, bicarbonate is 49. So first step is to identify whether this is alkalosis or acidosis. Looking at the pH, that's lower than the normal range, so we know that this is acidosis. Next step is to identify whether it's a respiratory or a metabolic problem. So let's go to our CO2. Our CO2 is 50. That's a lot of CO2, and remember, CO2 is associated with acid. So we can conclude that increased amount of CO2 is the reason why we have an acidosis problem. So we can put here respiratory acidosis. Because we have a respiratory problem, our next step is to look at our bicarb, and it's 49. This simply means that the body detected that there is a respiratory acidosis, and it tries to compensate by increasing the amount of base in our system. So we know that there is compensation. Now question, is this a full compensation or a partial compensation? To answer that question, all we have to do is look at our pH. Looking at this, our compensation was not enough to bring pH back to normal. So this is only a partial compensation. So remember, partial compensation equals abnormal pH because the compensation is not enough to bring the pH back to normal. So let's try another example here. pH is 7.50, CO2 is 51, bicarb is 41. So first step, acidosis versus alkalosis. 7.50 is above normal range, so we can put here alkalosis. Now let's look at our carbon dioxide. Our CO2 is 51, so that's a lot of CO2. But looking at the problem, we have alkalosis. Let's look at our bicarbonate. Our value here is 41. That's a lot of base in our system. So we can conclude here that we have a metabolic alkalosis. Since we have a metabolic problem, next step would be looking at our respiratory system. Our CO2 is 51. This simply means that our body detected that there is metabolic alkalosis, and it tries to compensate by increasing the amount of CO2 in the system. So we know that there is compensation. Now let's identify whether this is a full or a partial compensation. Was the compensation enough to bring the pH back to normal? No. So this is only partial. So what we have here is a metabolic alkalosis with a partial compensation. Now let's try this problem right here. Our pH is 7.35, CO2 is 49, bicarb is 30. We have a normal pH. We have an elevated CO2, which could indicate acidosis, but at the same time, we have an elevated bicarbonate, which could indicate alkalosis. How do we read this one? There are two steps to interpret this. First one is to know your patient's diagnosis. This would be one of the most accurate ways to read this ABG. Because imagine this, if your patient came in for a respiratory problem, COPD or respiratory failure, then we could interpret this ABG as a patient retaining a lot of carbon dioxide because of the respiratory problem. So for all we know, this could be a respiratory acidosis because your patient came in for a respiratory problem and the body is trying to compensate by increasing the amount of bicarbonate. So that's one. But if your patient came in for diarrhea or vomiting, so which means we're losing acid, we could interpret this ABG as the patient having metabolic alkalosis and the body trying to compensate by increasing the amount of CO2 in the system. So knowing our patient's diagnosis could actually help us interpret this ABG. However, if you're not given the patient's diagnosis or condition, and you're only given the pH, the CO2, and the bicarb, then I usually use what I call the acidic side / alkalotic side. We know that our normal pH is 7.35 to 7.45. The idea is that the lower our pH is, the more acidic our body is. And the more pH you have, the more alkalotic your body is, even though they're normal. To paint a better picture, the numbers 7.35 to 7.39 belong to the lower half of the normal range. So, in theory, even though we have a normal pH, the body is more acidic than alkalotic. So I'll just put here acidic side. And note the letter N, that means it's normal. The numbers 7.41 to 7.45 belong to the upper half of the normal range. So again, in theory, the body in these ranges is more alkalotic than acidic. So I'll put here normal alkalotic. Now, take this concept in mind and let's go back to our problem. We have a pH of 7.35. Now, this is normal. However, the body is more acidic in this range. So we can put here acidosis. Looking at our CO2, it's elevated. So we can conclude that the ones causing our acidosis is the elevation of our CO2. So we can put here respiratory acidosis. Since we have a respiratory problem, we can go look at our bicarbonate whether it's compensating or not. And by looking at the value, it's 30. The body is trying to compensate with the acidosis by increasing the amount of base in our system. So we know that there's compensation going on. Now the question is this a partial or a full compensation? Let's look back at our pH. It's normal. So that means that the body compensated enough to bring our pH back to normal. So this is a full compensation. In full compensation, it's going to result to a normal pH. Let's try another example here. The pH is 7.44. CO2 is 48 and bicarbonate is 35. pH of 7.44 is normal. But technically, the body is in the alkalotic side. So I'll just put here alkalosis, normal alkalosis. Now looking at the CO2, is 48. This could cause acidosis. However, we have an alkalosis problem here. So this is not what's causing the problem. By looking at our bicarbonate is 35. So that's a lot of bicarb and we have an alkalosis problem here. So we know that this is what's causing the alkalosis. So let's put here metabolic alkalosis. And by looking at our CO2, since we have a metabolic problem, we can conclude that the body is trying to compensate by increasing the amount of CO2. So we know that there's compensation. Let's put here compensation, and to identify whether it's a full or a partial compensation, we're just gonna go look at our pH with 7.44. So this means that the body compensated enough to bring our pH back to normal. So this is a full compensation. Phew, dance break.
That is it for today, guys. I hope you guys found this video helpful, and if you haven't already, please hit the like and subscribe button. By doing this, our videos will go straight to you. If you like this video, feel free to share this video to your friends and classmates. So, once
Okay, class. I hope You have learned the basic idea. अच्छा, मेरा क्वेश्चन अभी भी इफ्रा अभी आई हैं. इफ्रा, you are most welcome. मुझे ये बता दें आप सब लोग कि जब APGs परफॉर्म करने से पहले हम कौन सा टेस्ट करते हैं APGs सैंपल के लिए. बेसिकली कौन सा टेस्ट करते हैं? हबीबा हैं? इफ्रा, मैं वेट कर रहा हूँ आपकी. इसके बाद मेरी 6 बजे क्लास है आपके साथ. वीडियो तो 15 मिनट की थी बस. छः से 7 बजे तक मेरी आपके साथ फिर क्लास है. ABG सैंपल ड्रा करते हुए हम कौन सा टेस्ट पहले करते हैं? वीडियो मेरी है. तो भाई आप जो है ना एलन टेस्ट करते होते हैं. एलन टेस्ट the collateral circulation of the blood.
In case the physician does not have clinical pulse rate monitored, or does not have an ultrasound, minimum.
This is going to be a video on the Allen's test for blood circulation in the hand. To conduct the test, ask your patient to open and close the hand, squeeze the hand tightly. Then compress the radial and the ulnar arteries with your thumb. Hold it quickly and then ask your patient to open the hand and release the radial artery. And you can see how the blood is streaming back into the hand. We will now repeat the same process and release the ulnar artery. This is going to be a video on the Allen's test for blood circulation in the hand. For blood circulation. To conduct the test, ask your patient to open and close the hand several times as quickly as possible and then squeeze the hand tightly. Then compress the radial and the ulnar arteries with your thumbs. Hold it quickly and then ask your patient to open the hand and release the radial artery. And you can see how the blood is streaming back into the hand quickly. We will now repeat the same process and release the ulnar artery. This test determines the patency of the ulnar and radial arteries. With a healthy artery, the blood should stream back into the hand quickly, indicated by the red color. Make sure to always compare both hands to determine if an artery is impaired. Alright guys, this was our video on the Allen's test to test for blood circulation in the hand. If you want to get to know a method on how to assess the blood flow in the fingers, click on the video right here or watch any other special test for the hand right here. As always, I hope you enjoyed this video. If you did, give it a like, subscribe to our channel if you haven't, and give us a like on Facebook. This was Kai for Physio Tutors. I'll see you next time. Bye. This was Kai for Physio Tutors. I'll see you next time. Bye.
हाँ जी, आप मुझे बताते जाएं कि अस्मा खलील प्रेजेंट है। आपका परवीन प्रेजेंट है। नो। हबीबा प्रेजेंट है। इफ्रा प्रेजेंट है। बताते जाएं क्योंकि मैं फिर एब्सेंट लगा दूंगा। जूलियस नहीं है। लुबाना प्रेजेंट है। नीलम नहीं है। रोनाल्ड प्रेजेंट है। सादिया यास्मीन एब्सेंट। सहर अरूज प्रेजेंट। सिदरा जमील। सिदरा जमील भी नहीं है। इंशाल्लाह फिर मिलते हैं इसमें 6 बजे क्लास में आपसे। अच्छा 8 लोग प्रेजेंट हैं इधर। आसमा खान एंड वो तो नहीं है ना अपना सादिया यास्मीन, नीलम भी नहीं। Allahu Akbar.